Can rapid antimicrobial susceptibility testing improve outcomes for drug-resistant gram-negative infections? Do children who survive severe malaria have impaired cognition years later? Which antibiotic regimen is better for acute sinusitis in adults? This and much more on today's JAMA Editor's Summary. Hello and welcome to our listeners around the world. Today is Friday, April 24th, 2026. I'm Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief of JAMA and the JAMA Network. Today I'm joined by JAMA Deputy Editor, Dr. Preeti Malani. Hello, Preeti.
Hi, Kirsten. So you and I had an exciting week. We were in Munich for the ESCMID Global Meeting, where the following research articles were presented and concurrently published in JAMA. To begin, Dr. Banerjee and colleagues bring us the FAST trial, an open-label randomized study that included 899 hospitalized patients, both adults and children, with gram-negative bacteremia. Participants were enrolled across 7 medical centers in Greece, India, Israel, and Spain. Now, these are all countries where drug-resistant pathogens are a major clinical concern. Patients were randomly assigned to either rapid phenotypic antimicrobial susceptibility testing directly from positive blood cultures, plus standard antibiotic susceptibility testing, or standard testing alone. The primary outcome was a desirability of outcome ranking, or DOR ranking, at day 30 based on survival and key complications. The authors report that the differences between groups were not statistically different. The probability that DOR outcomes were more favorable in the rapid testing group was 48.8%, which did not achieve the pre-specified criterion for superiority. Mortality rates, hospital length of stay, and ICU admissions were similar between the groups.
The editorial by Dr. Srinivasan highlights that while rapid antimicrobial susceptibility testing did not demonstrate clear benefits in terms of mortality, there were some potential benefits in key secondary outcomes. The editorialists highlight that uncertainties remain, particularly in septic shock and in settings with limited antibiotic access, and emphasize that rapid testing may be a valuable tool, but not a universal solution.
Let's continue with our ESCMID global lineup and talk about malaria. Severe malaria remains a global threat, especially for children in Africa. Dr. Bangirana and colleagues followed nearly 900 Ugandan children for years after an episode of severe malaria and compared them to their healthy peers from the same neighborhoods. Most participants were tested 4 to 15 years after initial illness. The research team measured overall cognitive ability, attention, and academic skills like math and reading using standardized age-adjusted scores. The authors report that survivors of childhood cerebral malaria or severe malarial anemia, but not other forms of severe malaria, had lower overall cognitive ability and math achievement scores compared with unaffected community children when assessed 4 to 15 years after a severe malaria episode. The authors also noted the presence of acute kidney injury or certain blood marker abnormalities during the episode of severe malaria was associated with greater risks for cognitive challenges and decreased academic achievement. The investigators conclude that severe malaria, especially cerebral malaria and severe malarial anemia, can leave lasting marks on a child's cognitive ability and academic achievement years after recovery.
In their editorial, Drs. Sundararaman and John discuss how children who survive cerebral malaria or severe malarial anemia are at risk for ongoing cognitive challenges. They highlight the need for continued global aid and global health research to prevent malaria and the long-term neurocognitive risks.
The third and final ESCMID Global article addresses one of the most common reasons adults are prescribed antibiotics in the United States, acute sinusitis. Despite being so common, there's not consensus on which antibiotic should be the first line for treatment of uncomplicated acute sinusitis in adults, amoxicillin or amoxicillin-Clavulanate. Dr. Savage and colleagues used a nationwide healthcare database to conduct a retrospective cohort study. More than 500,000 adults aged 18 to 64 with new episodes of acute sinusitis were included, comparing those who started standard dose amoxicillin-Clavulanate with those prescribed standard dose amoxicillin. Each group included more than 117,000 patients with a propensity score matching approach used to minimize confounding factors. In this observational study, the authors reported that there was no significant difference in the risk of treatment failure between the two drugs, 3% for Amoxicillin-Clavulanate and 3.1% for amoxicillin, and adverse events were also similar. However, Amoxicillin-Clavulanate was associated with a slightly higher risk of secondary infections, 1.1% compared with 0.8%. The investigators conclude that for adults under age 65 with uncomplicated acute sinusitis, standard dose amoxicillin may be a preferred option.
Well, that's some very nice ID content, Preeti. We also have some other content in JAMA this week that's not related to infectious diseases. Dr. Mohan and colleagues assessed whether a low-cost digital intervention could help emergency physicians stick to trauma triage guidelines for older adults. They're testing an intervention that is theory-based, a serious game designed by behavioral science. A serious game is just a digital game that, rather than being for entertainment purposes, is designed for a specific learning objective. In this randomized clinical trial, the authors enrolled 800 emergency physicians from non-trauma centers across the U.S., and they focused on real-world outcomes using Medicare claims data to track the triage of injured patients age 65 and up over 1 year. Half of the doctors played a purpose-built video game on an iPad, 2 hours up front, and then a quick 20-minute booster each quarter for a total of 4 sessions. The other half of the doctors received usual education. The primary outcome was under triage, defined as the proportion of severely injured patients not transferred to trauma centers. The authors reported that among the more than 40,000 older Medicare beneficiaries, those treated by physicians in the game training group had a lower proportion of severely injured older adults who were under triaged, 49% in the game group and 57% in the usual education group. The rates of over-triage and composite outcomes, like 30-day death or readmission, were similar between groups. The investigators conclude that a scalable, serious game can improve trauma triage performance among emergency physicians caring for older adults.
Turning to lymphoma care, Dr. Xu and colleagues conducted a randomized, double-blind, placebo-controlled phase 3 trial. It included 423 newly diagnosed patients with MYC-BCL2 double-expressor lymphoma, a distinct population of diffuse large B-cell lymphoma recruited from 40 centers across China. In terms of background, this cancer is one that is quite aggressive. About a third of patients do not respond to initial therapy consisting of R-CHOP or experience relapse later. The investigators assessed whether adding Tucidinostat, a targeted epigenetic drug, to R-CHOP improves patient outcomes. All participants received R-CHOP. Half were randomly assigned to receive Tucidinostat, half got placebo. If they responded fully, maintenance therapy continued for 24 weeks. The primary outcome was event-free survival. The authors found that Tucidinostat decreased the risk of disease progression, relapse, or death by 28% compared with standard therapy. The 2-year event-free survival rate was 60.3% with Tucidinostat versus 50.5% for placebo. Complete response rates were higher too, 73% compared with 62%. Toxicity did increase with Tucidinostat, but was generally manageable with standard supportive care. The authors conclude that Tucidinostat plus R-CHOP outperformed R-CHOP alone in this challenging lymphoma subtype.
Dr. Ansell's editorial highlights that adding Tucidinostat to R-CHOP improves complete response rate and 3-year event-free survival with manageable hematological toxicity in certain subtypes of diffuse large B-cell lymphoma. The benefit is most pronounced in subtypes that are particularly relevant in Asian populations, although Tucidinostat's limited international availability and regional differences in these subtypes of diffuse large B-cell lymphoma add uncertainty to broader adoption. Preeti, let's talk about the latest JAMA research letters published this week.
In the 2025-2026 viral respiratory season, delays in updated federal COVID-19 vaccine guidance prompted various state-level actions, potentially impacting vaccine access across the U.S. In their research letter, Ulu-Rotimi Kokuyi and colleagues systematically reviewed public documents from all 50 states, examining official policy changes affecting COVID-19 vaccination infrastructure and access from April to December 2025. They found that 31 states took actions to strengthen COVID-19 vaccine access, while 13 states took actions that weakened access. 5 states did both, and 11 states made no notable changes. Expanding pharmacist authority and standing orders were the most common ways states improved access, while restrictions usually came through more exemptions or tighter clinician rules.
Suicide is a heartbreaking event, and it remains a leading cause of death among U.S. adolescents and young adults. In July 2022, the U.S. launched the 988 Suicide Crisis Lifeline, investing over $1.5 billion to expand crisis center capacity. Since the launch, Lifeline use more than doubled among young people. In their research letter, Dr. Patel and colleagues assessed the national death data from 1999 to 2024 for people ages 15 to 34. The investigators used statistical models to predict expected suicide deaths based on prior trends and compared those with the actual deaths after the launch of the 988 Lifeline. The authors report that from July 2022 to December 2024, there were more than 4,000 fewer deaths than expected, an 11% decrease. States with the biggest increase in answered 988 calls saw an even greater reduction at 18%. The authors conclude that the 988 Lifeline launch was associated with decreased suicide mortality among adolescents and young adults, especially in states with greater use.
JAMA also published some new viewpoints. Dr. Leff and colleagues weigh in on the future of hospital-level care at home and what a new 5-year Medicare waiver extension could mean for U.S. healthcare. They discuss how to optimize hospital-at-home programs and whether this approach can transform care delivery beyond brick-and-mortar facilities for an aging nation. And Dr. Bond and colleagues provide a critical look at preventing pregnancy-related cardiovascular disease, highlighted in a new report from the National Academies of Sciences, Engineering, and Medicine. They question why, despite powerful evidence and recommendations, too many women still face gaps in cardiovascular care before, during, and after pregnancy.
Take a moment and listen to the debut of Healthy Dialogue, a new JAMA podcast. Healthy Dialogue is hosted by JAMA senior editor, Dr. Derek Angus, and features in-depth conversations with the world's leading experts on the most pressing issues in health and healthcare. In this first episode, Dr. Angus is joined by Dr. Veenstra Vanderweel and JAMA Psychiatry Editor-in-Chief Dr. Dost Unger to discuss autism spectrum disorder. This conversation will explore the history of autism spectrum disorder, the role that genetics and environmental factors play, the importance of early intervention and treatment, and much more. Let's listen to a bit of this new podcast.
So intellectual disability is not actually part and parcel of the diagnosis of autism. And there's an increased likelihood that people with autism will also, unfortunately, have intellectual disability. But it's not the autism itself. It's like a collocated problem.
Yes, and some people now describe a group of people who have profound autism. That's the term that's been used some. And what that really means is a diagnosis of autism plus a diagnosis of intellectual disability, and usually enough communication disability that they're unable to communicate their basic wants and needs, and a much higher rate of irritability, and coming with that sometimes self-injury or aggression. This group of people is a group that we need to figure out how to serve better.
And in a JAMA Perspective article, FDA Commissioner Dr. McCary and colleagues lay out a roadmap for eliminating unnecessary animal testing in drug development. The authors explore how scientific breakthroughs are making human-centric models more predictive and reliable, pushing regulators to rethink what is truly needed for patient safety. The latest JAMA clinical review by Dr. Cooper and colleagues covers pre-pregnancy care and counseling. They provide a comprehensive summary for clinicians on how to best optimize health for individuals contemplating pregnancy. There's also an accompanying JAMA Clinical Reviews podcast. Authors Dr. Cooper and Brett Koff discuss ways to reduce maternal morbidity and improve neonatal outcomes with JAMA Senior Editor Dr. Karen Lasser. Let's hear a clip.
We haven't really discussed folic acid, and I think folic acid is something that's pretty widely known, but is a really important intervention to make sure that everybody is aware of to prevent neural tube defects. I would say, additionally, they're sort of, to me, like the big five to be aware of in patients who are trying to achieve conception. Folic acid, as we just mentioned, immunizations, we talked about weight management, glucose control, and then infectious disease screening. I think if you cover those things in this patient population, you've covered probably 90% of the interventions that can impact on their pregnancy.
And Dr. Kerber and colleagues have a Practical Insights article on benign paroxysmal positional vertigo, a common condition that can negatively affect quality of life and daily functioning. And this week's patient page is also on benign paroxysmal positional vertigo, and it's a great resource for patients to learn more about causes, diagnosis, and treatment of this condition.
This week's JAMA Plus AI Conversations podcast is about AI drug safety in pregnancy. Dr. Ahlquist joins JAMA and JAMA Plus AI Associate Editor Dr. Yulin Schwen to explore the urgent need for automated drug safety surveillance in pregnancy and to examine how advances in AI and computational methods may either reinforce or challenge our understanding of causal inference. Here's a bit of their discussion.
So I think how we build in AI and machine learning into these classical designs come from a sort of different way of approaching problems because they are typically not data-driven, but rather investigator-driven, and you sit down and you really map out all the problems. With AI and machine learning, typically we want the data to lead us, which can get us into real trouble because the ghosts that we're seeing in the room, we start believing they're real.
And as always, there's a lot happening in health news. The JAMA Medical News team has a summary podcast that publishes every Friday and gives our listeners insight into the latest medical news. You can subscribe at jamamedicalnews.com or click on the link in this episode's show notes.
That's a wrap for this week's JAMA Editor's Summary. Thank you, Preeti, and thank you to our listeners for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Kirsten Bibbins-Domingo. This episode was produced by Shelley Steffens and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.